Thank you so much, Mark, and thank you, Rebecca. Thank you so much for the invitation. It's really wonderful to be here, and one of the things that I'm hoping to do today is to give you a bit of an overview of the work that we've been doing at the GroundSwell project over the past 8 years now. I do want to acknowledge the fact that I really feel like I'm standing on the shoulders of giants. I'm here representing the GroundSwell project, but in fact we're very fortunate to be working with a number of organisations. We've talked a lot about partnership today, and I really feel like at the GroundSwell project we get to live partnership. Sometimes it is really hard work, as you know, really difficult, but it's so worth it in the end. And we've been fortunate to be supported by a number of organisations, and I'll talk about this towards the end of the talk as well. Will someone give me a 5-minute as well, otherwise I'll keep talking. Bupa Healthcare have supported us, the Wicking Trust in Australia, which is one of Australia's biggest trusts, Southern Cross Care are one of our aged care partners, and we have a number of university partners who literally kind of follow us around and do research about the work that we're doing in the field. And we learn from that research and we practice and iterate. And that over the past few years, our funding partners have enabled us to actually be able to do that. And that's been an amazing thing for us. So I want to acknowledge all of that. The GroundSwell project has a vision. We've been working on our vision. We constantly change our vision. As a not-for-profit and an independent, we can do crazy stuff like change our vision whenever we want, whenever we think that it's time to change it. At the moment, our vision is around looking at, we want to live in a world where everyone knows what to do when someone is dying, caring or grieving. And for us, the way that we do that, our purpose is around developing a death-literate society, one where people have practical know-how about how to do their end-of-life planning, how to do their caring, how to get support. That's what we call death literacy. And we've been doing, there's kind of a decade of research looking at death literacy and our understanding of death literacy. I will talk about some of that as well, because I think it's important to, we didn't kind of just make up the term because it sounds really sexy, right? We didn't, we came to that term with a body of research around what it takes to care and what it means. So the definition that we use is a modified one from the academic version, but it's just the practical know-how needed to plan well. We think about death literacy in 4 ways: that there are skills that people acquire and have and need as part of their end-of-life planning, that there's knowledge that you gain and experience from experience, that most of us learn about death and dying through our experiences. And that's been said over and over again today. What we found in some of the research that we were doing is that is an undervalued and under-talked about thing. That we don't actually say, hey, how did you learn about death and dying, and what are you now doing about that? And we found some pretty interesting things about how that happens in care networks. And then we found that when people experienced and were involved in death and dying, they often had a triumphant kind of experience that they wanted to share with others, and they wanted to tell other people about it. And again, in Australia, that hasn't really been it hasn't been part of our discourse to actually hear positive stories about dying well. So people will often stop me and they will say, I know you will understand this, but I want to tell you that when my mum died, we were with her and it was beautiful. and it was amazing. And it was amazing for all of these reasons. And these memories have stayed with us, and this experience has stayed with us. So that is something that we feel that death literacy brings to life. And it came from this body of research. So this is the second report that we wrote over kind of 10 years of research through New South Wales, which is one of our biggest states in Australia. This over here, is anyone familiar with this research? Some people, okay. What we did is we asked carers to tell us about who was important to them when they were caring. And we invited carers to bring all of those people into a focus group. And then we invited carers to take photos of the experience of caring. And we did a combination of understanding, talking about the photos of caring, because if as we've talked about today, it's actually very hard to talk about caring. People go, oh, I didn't really do much. Well, they do in Australia anyway. I didn't do anything. I don't know. I didn't really help in any way. But if you have photos, people can talk about caring quite openly and give you a number of stories about the experience of caring. And then we asked people to kind of map how they worked together. So this is a caring map. And I'd be interested to know culturally if this kind of sits for people here. But what we found is that there was often an inner network that developed around the person who was dying. You'll notice that the person who is dying is not on here, that it is the care network, not the network of the dying person, which could be different, but we didn't research that. We researched the caring network. And then we started to find that there's this kind of other network, this broader network that started to develop around the person who was dying. And I guess one of the surprises for us and for many of the health professionals that we work with is a real decentering often of the work of the health professionals in the care network. So Alan, was talking this morning about 95% of the care is happening. This is the 95% of the care that's happening here. The other thing that we found is that often, if you notice here, the community nurse has the relationship with the daughter, not so much the carer. So there were hidden relationships in these caring networks that we as health professionals don't see, and we certainly don't know about, and they might not even be legitimate. So that daughter may or may not have relationships with other people here. They certainly don't have a relationship with the doctor based on this map. Does that make sense? Yeah. So we wanted to understand what emerged from this is that everyone learnt about dying. Everyone learnt about death. Everyone learnt about how to care for someone who's bereaved. And that's where the term death literacy emerged from. We found that over time, so this is a care network before caring, a year or two out from caring, and this is a care network after caring. So you notice, without giving you vertigo, which I could, there's a change. So we found that for the most part, people who were the care networks of people grew over time. When someone died at home, it often has to grow because they need support from their friends and their families. But no one had we've never really been able to get evidence of this change in the social networks, the care networks of carers before now. The other thing that we found is that the people out here, out on the edge of the network, were also learning. So they didn't necessarily have a hands-on role in terms of the physical care, but they were learning about death and dying. Some of these people said, I didn't know that you could care for someone to die at home. I didn't know that was possible. And through the process of being involved in this care network, it they were able to learn that. The other thing that we started to see is a change in, we started to think about death being not just about the health system, but actually about the death system. So death literacy is about understanding the death system, not the health system. And that's really important because in palliative care, actually my research, my PhD also showed evidence for people in palliative care and healthcare roles actually not knowing about what's happening in the community at all. They don't know about funerals. We've heard today about some of the work that's happening outside of institutions and outside of the formal system. The people outside of the formal system are often highly death literate because they know all of the policies, procedures, the best doctor to go to, the GP who will help you to die at home, whereas those of us in the system, institutional death workers, we often only know our lot. So the evidence from my PhD started to show that actually we have all these silos of care. Health professionals only tend to work in their silo. Palliative care and the work that we do in the palliative care space is often very limited. Compassionate communities, on the other hand, goes across all of this. People who are working in the community, who are death workers in the community, death doulas, death educators, natural funeral directors in Australia, community workers, community development workers, they have no boundaries. Doesn't matter if you're bereaved, doesn't matter if you've just started a curative care and you're thinking about your death because you've been diagnosed with cancer. It doesn't matter to many of the community death workers, they will work across. So that really has been like the underpinning of our work at the GroundSwell project, around thinking about how now do we bring that to life in terms of a compassionate communities approach. So we've done that in three main ways at the moment. Our three primary ways are Dying to Know Day, which was a crazy idea about 6 years ago, completely unfunded. It's still unfunded. We do it because we're passionate about it and we're a bit nuts. And does that translate okay, a bit nuts? Yeah, yeah. I should know. Yeah, good. So there have been 411 events across Australia over the last 5 years. Every year it grows, started with 23. It grows every year, it grows through word of mouth. It grows because it isn't necessarily about one aspect of the death system. Anyone can get involved. We encourage regular people to do things in their lounge room. We encourage social workers to run events in their hospital. We encourage everyone and anyone to do anything, any aspect of the death system, any aspect of death literacy, and that seems to work. We've had lots of kind of arts-based events. The other thing that it has done, which is really exciting for us, is that it has created other organisations. Groups of people like Brahmyodo type collectives are now forming other organisations and other initiatives and doing their own work that goes on all year outside of the system, unfunded, passionate people going for it in their own community. One of those initiatives is the Coffin Club, which was with the Men's Shed, thank you, which was with the Men's Shed. And the people, if you go onto Facebook, you can find the GroundSwell project and Dying to Know Day, but you can look up Community Coffin Club and find that in Tasmania, and that they're community members building coffins for other community members, or you can build your own. The other thing that we do, and Holly is here today, Holly is our national lead for compassionate communities. We put out a call for action. We wanted to help try and build the capacity in Australia to do compassionate communities work 30 communities came forward. We couldn't work with them all, unfortunately, but that's amazing, and it's also kind of a sign of how this work is starting to build in Australia. We're going to be working with 8 communities over the next 18 months, really a bit like what Bonnie was saying, to kickstart, to really kind of help things along in their community. We're working with communities from 300,000 all the way through to, they're all our communities. Some of them have communities of 300,000. This is one. Others, this one here, there are 400 people. And how do you put it, Holly? 400 passionate older people who want to die at home. There's no public transport. There are very few doctors and health services. They want to find a way to be able to stay in their little town. Makes sense. So that's really exciting. That's our website. And then really, I guess we've been trying to get funding for years to understand more about death literacy. And the Wicking Trust gave us some funding where we could work with Western Sydney University to develop a population-based measure around death literacy, around those 4 things that I was talking about before. So this should really help us to understand how compassionate communities work in Australia, in whatever shape or form that takes, should start to shift behaviours and attitudes and connections in communities. And that's something we're in June this year, we will be releasing the initial findings of some of the survey results around that. And we know some of them already, and it's been quite challenging and really fascinating to look at that data. The next 3 years, we're looking at we thought we'd just go a bit more nuts. We've been able to get more funding from independent trustees and other people. We're going to work with an acute palliative care ward in one of our biggest hospitals in Sydney to see what happens when you put a community development worker into that space. How can we change up that space so that it isn't just some weird ward that the community go to if they've got terrible symptoms and need acute palliative care? How do we change that up? Can we bust some myths in the community around an acute palliative care ward? We're also working in an aged care facility. We've again placed an aged care, a community development worker in an aged care facility to see if we can make the walls impermeable, really. And some of the preliminary findings in that work have been really challenging for all of us and for the aged care, the aged care facility as well. There are heaps of activities going on. I don't know if you can relate to this. Heaps of activities, bingo nights, lots of bus trips and stuff like that. But people have lost their relationships to the people that they love. We're doing something from A to B where people are becoming so institutionalised. All the people they have relationships with and they love are dropping out of the zone. And for us, that's not okay. That's a social justice issue, and we want to shake that up. If that model works and we can find some ways to change what's happening in aged care, we want to spread that through the work that's happening for the agency that have funded us to do that. And then the 6th International Public Health and Palliative Care Conference in Sydney, yay, that you'll all come to, right? Yes, it's in the Blue Mountains. Yes, lots of nodding, yes, good. We are expecting lots of papers from Scotland, and we will host you in the Blue Mountains. I'm hoping that there might be a late snowfall, just so you feel a bit, at home. Although I am a bit disappointed, I thought it was the land of the ginger here, but I can see there's 2 of us here with purple hair, so, So please, thank you, that's it from me. Please do get in touch with us, we'd love to talk more, and we're really looking forward to to having more connections across the world with people who are passionate about this work. Thank you.